Hello.
Hi, this is Jonah from Unitech Medical Center. I'm reporting on Mrs. Jones. She is a 31-year-old Caucasian female, gravid 3, para 2. She delivered at 40 weeks to a female weighing at 8 pounds, 7 ounces after 17 hours of labor at 400. She was given an epidural for labor, 3 hours staged with vacuum-assisted delivery and midline episiotomy. Her lab results include blood type A negative, rubella immune, RPR non-reactive, hepatitis B negative, and HIV negative. Vital signs are temperature 98.8 Fahrenheit, heart rate is 98, respirations 13, blood pressure is 134 over 78. Patient is found to have excessive blood on chucks, pads, and peri-pads. Requires evaluation of blood loss and initiation of postpartum hemorrhage protocol and call for assistance. Stage 1. The team will have to manage postpartum hemorrhage up to 1,000 cumulative blood loss for a symptomatic patient for stage 2.
Okay, great. Thank you.
You're welcome. Bye-bye.
Hi, good morning. My name is Audrey, and I'm going to be the nurse caring for you today. Can you please verify your name and date of birth for me?
Yes, Stacy Jones, 11/21/1989.
Okay, perfect. Thank you, Mrs. Jones. So your baby appears to be very healthy, and she's doing well. I see you've eaten your breakfast and used the restroom to empty your bladder. Is there anything else I can help you with?
I actually wanted to ask you a couple of questions. I'm having terrible pain in my abdomen. I don't know what's going on.
Okay, Mrs. Jones, I understand you're in pain. What I'm going to do is I'm going to assess you to see what's going on.
Can you please?
Okay, so I noticed that you're bleeding, so I'm going to call for some help to see if we can control the blood loss. I also noticed that your fundus is slightly boggy but firm, with a message at 2 finger breaths above the umbilicus and deviated to the right. What I'm going to do for you is I'm going to continue to provide for a firm fundus massage.
Okay, is this going to hurt? Will the bleeding stop?
So your provider has been notified about your increased bleeding. Dr. Smith has ordered a platelet, hemoglobin, and hematocrit laboratory test. Also, he has prescribed oxytocin to help stimulate your uterus contract. So this is going to help decrease your blood loss. Also, we're going to be administering 2 liters of oxygen per minute through a nasal cannula, and this should help you feel better.
Okay, so you stated this medication will help my increased bleeding. Why am I bleeding so much?
Okay, so you have increased bleeding because you have chorioamnionitis, which is a condition um, of the fetal membranes due to a bacterial infection. Also, since you had a vacuum-assisted birth and a prolonged birth, this also contributed to the postpartum hemorrhage as well.
Okay, thank you for explaining that to me.
Okay, Mrs. Jones. What I'm going to do now is I'm going to measure the amount of blood loss.
How are you going to measure it?
So I'm going to be measuring the soiled perineal pads to account for your blood loss.
Oh, okay.
Okay, so how are you feeling now? Can you rate your pain on a scale of 0 to 10 for me?
Yes, I feel good, less pain now after the medication. My pain is about, let's say, a 2. That was really scary.
You did great, Mrs. Jones. Do you have any questions?
No questions at this time, but I will let you know.
Okay, perfect. I'm going to go ahead and report this to your provider, and Dr. Smith should be in shortly to speak with you.
Thank you.